I've been known to use my gloves as another sterile field to have handy, so definitely something you can use as an extra space for you to place things. Remove your jewelry when you do this as well. Something I didn't do in this demo, but you may want to remove your watch and your jewelry. Okay, so here is a fenestrated drape all ready to go. These have a nice sticky spot with a circle. So I am sterile at the moment, so I'm going to be able to open this up. Now you could choose not to use this sticky area, or you can use it. I'm going to attempt to use it. And you want to place it over the area that you are going to be doing your venipuncture. And what's nice about this is it's a pretty large drape and it's plastic, and now that's all sealed. So I am able to touch everything, and if something were to hit this, I'm pretty safe with my sterile field. So the very first step that we're going to have in a central line placement with a Seldinger technique is going to be placing the introducer catheter. So in the kit you will find a catheter of appropriate size for this line, and just like any peripheral type catheter, you would place that accordingly. Now, many of our patients, I was mentioning the stab incision. I can't quite do that on this model, but what I want to envision is that you would pinch the skin up, and I prefer to use a 15 blade, and I would hold it upward instead of downward. I feel like that's safer. I would pinch up in a 1/10 and just go quick stab and then lay it flat over the jugular. And that allows me to feel secure that I won't accidentally nick the jugular. In this particular model, I can't do that. So I wanted you to just kind of see what that would look like. And then there is actually a little insertion poke that was from a previous catheter in here that I'm going to utilize. So you may be doing this, if you're right-handed, you may want to be positioned differently. So I can place these in different angles. But when you're new, you might want to be more attentive to your right-handed, so perhaps the patient being on the other side and using the left jugular here would have been easier for me in this filming. But my mannequin said otherwise, so I'm doing it this way. So all I'm doing is just making sure I continue to maintain my sterility as I place this catheter. So there is water flowing through here. That is my blood. And I'm going to thread this. And I'll remove the stylet, and you can see that some blood, or some fake blood, came out. As you can see, a little bit of gauze. I'm just going to leave a little gauze there to just help keep things clean. Okay, so now that is pretty much the standard first step of the Seldinger technique. Placing an introducer catheter. And you know, in the olden days, we used to just use the catheters that we were comfortable with, because a lot of these kits came with strange catheters or catheters we're not comfortable using. So feel free to use what works for you, but you have to make sure that the size fits the central line. So that's why I love these kits, because everything is all together. It's stuff that we use, that we're comfortable with. Everything is very recognizable. The second step will be using your J-wire. So the Seldinger technique is a through the catheter technique. So what that means is there's a it's a guide wire technique. So basically what you're going to be doing is you're going to be putting a wire through the IV catheter. You'll be removing the catheter, and then we're going to be placing the central line. So this is a really cool little tool. They sometimes are slightly different in depending on the size and what they look like, but they pretty much are a wheel with a wire, and you can see there's a little J in there. See that? And if you pull it back, because there's like a little space here, you can use your finger, it goes away. Well, basically it makes it straight. This is going to do a couple of things. It's going to protect the inside of the heart. When you do poke inside the heart, potentially, you go too far, it's not going to damage anything. And then, of course, it's going to be there only temporarily, so we don't want to do any damage while we're there. So I'm going to go ahead and insert this in here, as like that. And what will happen is you will actually see little notches. There's a little black notch on this wire. That's one notch. And then when I see the second notch, there's going to be 2 black notches. I usually go about 2.5. At this point, I stop. And I put down this on my sterile field because I want to save that. So they will have 2 notches, and then this is 1 notch. That would be your warning. Don't go. This is too far. You do not want to ever let go of this wire or lose this wire in the patient, right? That'd be not good. So what we want to do now is remove the catheter off of this wire without really moving the wire. So it could be a little tricky, but you can hold this still and bring the catheter up. And you see I'm holding the wire the whole time. You also can appreciate why it's important to have a sterile field. If this wire is very long and I touch things, including my scrub top, it will get contaminated. So you have to be very careful. Hence why wearing a gown during this may not be a bad idea. So once this step has been completed, you now need to dilate the vessel. And dilating the vessel entails grabbing one of these dilators. Sometimes you have more than one size dilator. They come in these interesting sheets, like that. And I'm going to pick the larger one. As you can see, they come in 2 sizes. So I'm going to pick the larger one. And the purpose of the dilator is to dilate the vessel enough so that the catheter will pass over the wire and into the vessel. This is a little bit tricky. You may have to like really concentrate on the little insertion there to get it in there, but take your time. And when it comes out the other end, you know, grab it. And once you get to the point where you're at the insertion of the patient, you're going to kind of forcefully twist it side to side. You may feel a little pop. And I'll usually go about a quarter to a half of the length of the dilator into the patient the first go. I tend to be gentle in that sense. Some people are more aggressive and will do 3/4 of the length. But use your judgment on the patient and how it feels. And once this is dilated and I go to pull this out, again, I need to be careful that I do not lose my wire. So I'm holding my wire and backing this out. I'm going to expect there to be a lot of blood gushing from the insertion site. This is also where the guide wire will often flick around and get contaminated, so be very careful. Now I'm going to put this away. So this gushing here means, this gushing blood means that I dilated this vessel pretty well. And hopefully my central line catheter will just slip right over that wire and go right in. Central lines come in different sizes. They're double lumens, triple lumens. This is a double lumen. They have brown ports, white ports typically, and blue ports also. And brown port is going to be your universal port that will be the one where the wire will come out of when you thread this over. So I'm simply, again, watching where I am with this wire, making sure that you can understand that you do not let go of the wire. You just keep threading this, and this also helps me. This drape is helping me quite a bit. And once I get to a point where I have the wire in my hand right now as close as possible, but I don't see my wire come out of the blue port, I'm going to back the wire out of the patient until I see it. Because I want to make sure I don't lose it. All right, there we go. So at this point, you can see the wire right there. So I'm going to change my positioning to holding that wire here, and hopefully this will just pop right in. It did nicely, and I can thread this all the way in because I measured a 13 centimeter patient. The entire catheter is going to go into this patient right there. At this point, there is some blood flowing out of here, so I'm just going to clamp that so my patient doesn't bleed everywhere. Definitely showing me that it's patent. And I'm going to take this wire out and I'm going to keep it together and sterile. Hold on to that. In my kit, never mind, I'm going to take a sterile flush. Some kits will have a syringe. Oh, it's bleeding back now. There, it's bleeding back now. If it doesn't bleed back on its own, you need to aspirate blood out to make sure you evacuate that air. So I'm just going to lay this down for a second. They're clamped. And I'm going to attempt to re-thread my guide wire without contaminating it. And this is sort of an extra step. Not everybody does this, but I have been fooled many times by central lines. And when I'm done suturing, it doesn't work, and I want to troubleshoot it. And I often wish I had my wire still so that I can run that wire back in. So I like to re-thread my wire so that I can use it again if I need to. I put that on my sterile field and I'm good. So at this point, I'm going to put some caps on this. So here I have a little flush. I'm just going to flush this in to make sure, that it flushes well. And you can see I'm getting blood. Now these kits may have caps in them. This particular kit does not. A lot of the caps that you will find are needleless. So you can definitely shop and look around for what you like. I like to have them ready to go if possible. This particular one did not have it. Okay. It's okay, we can do the caps at the end. Right now we're good, we're clean. Next up, I'm going to have to suture this. So what's cool about this particular catheter is there's like, well, most of the central line catheters, there's a wing and there's also a little notch right ahead of the insertion site. So I always like to suture that first. And this kit comes with a little suture pack. They actually give you a choice of both curved and straight, but we're going to use the curved. I'm a person that likes curved. So you just go ahead and do a couple of surgeon's knots. At this point, people become a little bit more casual about sterility. I mean, for the most part, you're probably good. You're just going to do a tube check. Even if you had to adjust it, you really should not push the catheter in. You should only pull the catheter out if the tube check shows that the catheter is not in place. So I could run and do a tube check right now. This is just one suture. Make sure it's in. Maybe I'll just throw a very quick vet wrap on it, x-ray the dog, come back, and it's in. I'm going to come back, and even with the drape off the patient, I will continue to just suture. So as an example, I'll just go ahead and just get rid of these little gauzes. So I'm having a little bit of a mannequin challenge here where my drape is actually in my way of suturing. So in a patient, a live patient, it likely wouldn't happen. It's just the anatomy here. Oh, there's why Olsen Hagers are always a little tricky. Always be careful that you don't cut your suture. Okay. All right. So this is already sutured. I'm gonna put a couple of caps on these just to see what that looks like, so you can see it. So these are actually, they make these, whatever. They make these needleless sets, and they actually come with little caps on top of the needleless port. For those of you who are not familiar, but they are needleless. And then you can see I can test my patient's patency that way. So placing a bandage on a patient like this, I'll put that in another video, but basically it's a 3-layer wrap. I'll use a sterile gauze or a sterile telfa on the insertion site, and then I'll wrap it with cast cling and that wrap. And that should be changed daily, although there's some information out there that says less is better, so you're not handling the insertion site. And the other thing you can also keep in mind is when you're handling the central line, when you are replacing bandages and accessing the insertion site, you really should wear sterile gloves. Wearing regular gloves for handling the ports on the outside is fine, but the sterile gloves are going to be appropriate for handling the insertion site and maybe scrubbing and cleaning again and then rewrapping. So definitely look at some SOPs for catheter care and decide the best way that would work for your hospital. Thank you.